There are people who are put on this earth for a reason. No matter what life hands them, they have a higher purpose and know it even at a young age. Now, this next story took more than 20 years to tell, and I am honored to bring it full circle. It's about a mom, a daughter, and a doctor, and how even the most difficult adversity can bring good.
I see her a lot in the eyes of these patients looking back at me.
Dr. Leslie Brown is talking about her mother. Karen Pike died of breast cancer in 2008.
I see the things that I remember, the anxiety, the hope.
You see, it was her mother's 13-year battle with cancer that made Leslie Dr. Brown.
Hearing the words that my mom had cancer and then hearing it that she had a recurrence and over again, a total of 4 or 5 times, it just solidified what I wanted to do with my life.
Karen found a lump in her breast.
I was numb.
It was back in 1995 that her mom heard her first diagnosis.
Karen Pike is an Evansville woman who knows firsthand about such treatments and about how breast cancer can change lives.
And 5 years later, in 2000, I interviewed Karen for an ABC 25 special report called Cancer in the New Century.
We hugged, we cried.
Karen went through 2 lumpectomies, a mastectomy, and about 1.5 years of chemotherapy.
I dug out that video to share it with Leslie.
When I heard that this video still existed, I have been just looking forward to seeing my mom again, more than you could possibly imagine.
It was the first time she's heard her mom's voice since she passed.
So this will be their very first time seeing Grandma Karen. I can't wait. I can't wait.
Grandma Karen! I'm a better person inside for having gone through that than I was at that time.
My mom was one of the most graceful human beings, one of the most joyful human beings. Despite everything that she went through, she just was an absolute shining light.
Karen battled her cancer all through Leslie's childhood. That's little Leslie right there.
I've been told I was a pretty serious kid.
Yes, she was. At a young age, she took on a lot.
I took over as many little roles as I could to try to help out. And so I would bring her cold rags for her forehead when she was sick and I was 7.
And that's where fate stepped in.
I met Leslie Brown when she was Leslie Pike at age 7, sitting on a couch in her mother's hospital room.
Dr. Anthony Stevens was Karen's oncologist, who clearly made quite an impression.
I decided at about 7 years old that one day I wanted to grow up and be like him and join him in his practice.
And she did.
She resolved early on that while this was a terrible thing that was happening to her, that she was going to make something good out of this. And so I give her all the credit in the world.
At that time, he was able to connect on a human level. He treats the patient first before the disease.
Now an oncologist herself, Dr. Brown is treating cancer patients, much like her mother, in the same practice with her mother's doctor.
I call myself her work dad because I'm really proud of her. Strong in character, smart, great insight.
Her desk sits right next to Dr. Stevens, and her mom sits there too.
And I have a picture of her bald.
In a frame with daisies.
She has the brightest smile.
The photo taken right before she passed.
And so I look at that every single morning and I remind myself the difference that we have the opportunity to make in this field. I know she would be very happy and very proud that I'm able to use some of this trauma that we have had experienced as a family and pass it on in a hopeful way to other people dealing with the same horrible disease. And most importantly, I think she'd be proud that I'm doing it as a mom.
A mom of a little boy and a little girl, both with those beautiful dark eyes and golden hair.
I have dark hair, my husband has dark hair. I don't know where they came from except for Grandma Karen. And seeing them every single day reminds me that she's still always watching.
And Karen is still watching and having a big impact on many people who remember and love her. Her mother's history means Dr. Brown is at high risk of breast cancer. She told me that she is adamant about getting screenings twice a year, which includes mammograms, as well as an MRI or ultrasound. And she encourages every woman to talk to her doctor and make sure she gets annual screenings.